right, so this talk is a part of tonight, which is yoga therapy as part of multidisciplinary healthcare. And the IIYT Magnet School initiative, you can make this happen. The objective for today is that we will be able to understand the role of yoga therapy within the expanding field of multimodal healthcare and how the IIYT Magnet School initiative is poised and dedicated to yoga therapy as a first-line treatment in healthcare. So yoga therapy as a part of multidisciplinary healthcare, you can make this happen. Pause here, just a little bit about my background and how my path is joined together with your path. I am a CIAYT ERYT 500. I am the founder of the International Institute of Yoga Therapy. We'll get into that a little bit better. And that is part of the company, the LLC Yoga Developments. I'm a two-term president of the International Association of Yoga Therapy, a two-term vice president of Yoga Alliance. As part of Yoga Alliance, I was chair of standards. I was chair of the prenatal specialization standards, of Yoga for Children standards, and I'm currently on the evidence committee for the Academic Consortium for Complementary and Alternative Healthcare. I'm a co-curricular faculty instructor for Wayne State University School of Medicine. I'm a faculty adjunct instructor for Oakland University William Beaumont School of Medicine, and I'm a clinical lecturer for the Oakland University School of Health Sciences. And I've been in this field for probably longer than you've been alive for most of us here. The order of presentation that we'll look at today are the applications and evidence of yoga therapy, its safety, implication for clinical practice, clinical considerations, and future directions, where the IIYT Magnet School initiative folds into our conversation today. When we look within the context of yoga therapy, we have to ask, so what is it? How is regular yoga different from yoga therapy? And what does a yoga therapist do? These are very foundational questions, and it helps in this conversation to respond to these questions before we move forward so that our discussion continues to be meaningful. So this is a cartoon, and we'll come back to this. But many people, when asked to describe yoga therapy, say, well, it's kind of the way you move your body in a healthy way. So a little bit of rotating this and a little bit of range of motion here and a little bit of bending here, and everything is done where it's okay, and it rotates and moves and revolves and extends and flexes. So we'll come back to this, where if yoga therapy indeed is this the embodiment, and I use that word like a pun, of yoga therapy on maybe a different level than yoga teaching. Well, we'll come back to this. How is regular yoga different from yoga therapy? First of the questions. Question number one. This is a picture that might not be your class, but is not unfamiliar to what you think of maybe as a yoga class. This is what we call like the purple mat class, right? The purple yoga mat class. Commonly, it's situated in a studio type environment, and it offers various styles of movement-based yoga to the general public, referred to as students or clients. Depending on the curriculum of a regular, which is more or less 200 hours of yoga teacher training, a yoga teacher might or might not have basic training or experience in common disorders, pre-existing physical conditions relative to any student attending a yoga class at any given time. And this is the representative organization for yoga teaching. I do have to say that from this is a stock picture, but all photos included in the rest of this presentation are HIPAA compliant and have full consent for using the photos that we're about to see. Okay, but what is yoga therapy? Question number two. Yoga therapy is part of a multidisciplinary health and medical treatment. It provides a patient with self-management techniques to benefit their overall health through effective and adaptive breathing, meditation, and selected movement when appropriate. That means it might not be appropriate. It means we might never go there. Yoga therapy focuses on offering instruction in methods that can help manage and induce a sense of comfort, thus improving compliance and function. Regular applications of yoga therapy can help reverse stress-related symptoms, generate a sense of healing or comfort, and self-actualize a meaningful quality of life. Certification in yoga therapy involves advanced training, clinical experience, and exposure to research. What you're seeing now is the description of yoga therapy that IIYT has developed, right? And uses. Generally working within clinical environments, the yoga therapists meet with individuals referred to as patients on a one-to-one or small group symptom-specific basis. A yoga therapist can enter information about the patient encounter into an electronic medical recording system. Now, this is important because every medical professional from that moment on who is connected to that patient for any reason can review the note provided by the yoga therapist and electronically stored forever. So there is training involved with that. Curriculum and yoga therapy certification is over 1,000 hours of advanced training, clinical experience, and exposure to research that adheres to an academically based model, emphasizing the integration of yoga therapy techniques within healthcare environments and research protocols. Again, this is the description of yoga therapy put out by IIYT, right? This organization. And there's the representative organization for yoga therapists by which we adhere to their standards and through which we have been accredited. Okay. Yoga therapy is not an alternative to traditional treatments. It should be accompanying medical treatment, providing the patient with another potential tool to benefit their overall health. We receive both physician and self-referrals, and that is both for on-site, outpatient, inpatient, and virtual treatment plans. Generally working within a clinical environment, the yoga therapist meets with inpatients and outpatients on a one-to-one or small group symptom or disease-specific basis. And there we see some yoga therapists in our program during their clinical externship, by the way. Now they're faculty doing the work of a yoga therapist. No purple mat. No purple mat here. Okay, this is what we do as yoga therapists. For inpatient bedside yoga therapy is generally geared for paraprocedural pain, anxiety management, oncology, ICU, orthopedic and palliative care, and includes friends and relatives for self-care and caregivers. Patient logs are provided to the yoga therapist by a medical team, and paper-based notes, patient self-evaluations, external self-evaluations, and supervisor evaluations are retained for educational purposes. Pretty much the same for outpatients, which is a one-on-one, in-person or virtual. Yoga therapy is physician or self-referred. Paraprocedural. So what does paraprocedural mean? Paraprocedural means pre-procedure, during procedure, and after the procedure. So we are one of the only programs in the United States that provide mentored, supervised yoga therapy exposure with live patients during their procedure. That means while they're in the operating room, in the procedure room, the yoga therapist and the clinical expert is right there next to the patient. Hospital-based small group support sessions, you can read for yourself there, and paper-based notes. As yoga therapists, this is what we do not do. We do not diagnose, prescribe, touch, treat, or cure. And the key words for therapeutic interventions in yoga therapy are multidisciplinary, self-management, and adaptations. A little bit about IYT. It is the only fully accredited yoga therapy program in Michigan. It provides a dynamic curriculum dedicated to clinical applications of yoga therapy, didactic and experiential work in the field, and postgraduate specialization in yoga therapy fellowships. IYT graduates are eligible for RYT registration at the 500-hour level. It's the highest level offered through Yoga Alliance, as well as certification in yoga therapy with the IAYT. Okay, this is where Namaste fits in. IAYT offers a multi-year curriculum focusing on a tri-level course of study. Level 1 is the basic 200-hour yoga teacher training, and this is the motive power for the IAYT Magnet School initiative. Where do you fit in? How can you make this happen? We'll get more into this later. The other 3 levels are where Ken, Kyla, Sean, and Stephanie are in various degrees. It's level 2, didactic instruction, and there you can see the areas of study. You can read that for yourself. Level 3 is virtual and on-site clinical externship, and level 4 is the postgraduate specialization in yoga therapy fellowship, where we have now 5 ongoing NIH-funded studies. We are in our 10th year as a fully accredited program. The program provides mentored and supervised yoga therapy as part of multidisciplinary approaches to patient-centered care and research, and graduates can deliver self-management yoga therapy tools that have been shown to help reverse the effects of anxiety, stress, pain, and fear in patients during diagnosis, treatment, adaptation, and recovery. What you see there is a kind of a graphic of what Ken just was so masterfully leading us through, the koshas. And pictures are great. Of course, star-studded pictures of Ken in the lower right, which is, Ken, do you remember when you were a clinical extern? Jenny is to Ken's left. She's wearing her leads, and she's also a faculty member at Namaste, and also with IIYT, and with Anu, who is at that time a clinical extern. In the upper, on the lower left are 3 clinical externs as Keisha and Anu and Sierra. On the upper row on far left, these are 2 of our postgraduate specialization in yoga therapy fellows, Julie and Zoe. They are in our affiliate hospital of Corewell Health in Grand Rapids, and they are doing their postgraduate specialization in yoga therapy research. Now a multi-site study, also including Dearborn with Michelle Lawson in OB maternal fetal medicine with inpatient pregnant women who are hospitalized for months due to problematic situations with either their baby or their own physical health. And to the upper left, this is Beverly Lachard, who is giving at the moment of this picture, a lecture to the University of Michigan, Michigan Medicine, through Henry Ford Health, on how yoga therapy can help with pain and fatigue. This is for school medicine. Okay, virtual yoga therapy is also important. These are one-on-one or small group, need-specific, symptom-specific. We also have virtual yoga therapy through 4 one-on-one sessions, and Ken and Sean can talk to you more about this. And this is what it looks like when we're virtually getting together to talk about patients. There's Ken. Ken, there you are during your clinical externship. What are the applications of yoga therapy? First, we'll do applications, then we'll do evidence. These are our clinical externs in MS, in Parkinson's, children autism, ovarian cancer, COPD, pediatric PT. These are our referrals for yoga therapy. These are typical referrals. What we are working now on is including psych through McLaren, and not yet on this list. This is what a virtual one-on-one patient log looks like. What is interesting, this is pretty much bread and butter stuff. I know, Ken, I think your stomach just flipped, and I think Sean's did too. But this is kind of what we see on a yoga therapy clinical Sunday. These are live patients. These are not simulated patients. They're DX, their diagnosis. As you can see, what's interesting about this slide is the span, is the range of what our clinical externs are exposed to in terms of their chief complaint. Anxiety, neck, shoulders, breast cancer, thoracic pain, oncology, back surgery, knees, diabetic neuropathy, generalized pain, back fusion, wanting to learn to breathe, muscle tone, oncology, COPD. This is a wide range of what we look at as chief complaints. And this is the day in a life on a Sunday of a clinical extern. This is just a kind of a snapshot of our patient recording. It is based on a electronic medical record system. Now let's look at evidence. I'm going to go through this rather quickly for the sake of conversation and time. But today, April 16th, on Google Scholar, I looked up how many scholarly articles were published in the last 16 months. In the last 16 months, not since, the Middle Ages, in the last 16 months on yoga therapy in these specific areas. 15,900 articles were published in the last 16 months on yoga therapy for stress and anxiety. 14,600 published articles in the last 16 months on safety of yoga therapy. 14,000 on low back pain, 11,600 on yoga therapy and chronic pain, up a lot from 6 months before that. 9,000 and change on diabetes, 8,000 and change on SUDs, 8,000 and change on high-risk prenatal maternal fetal medicine, and almost 5,000 published articles on yoga therapy and breast cancer. This is huge. This suggests a robust, motivated, and increasingly compelling field driven by evidence-based research, not case studies. All right, a little bit of the evidence then. I'm going to click through this very quickly. Please let me know if you want reprints of everything here. Yoga therapy for rheumatic diseases. This is published by the current rheumatology report. Yoga therapy and physical therapy or education for CLBP. This is a randomized non-inferiority trial. What is a non-inferior trial? It means that yoga therapy and physical therapy were put side to side and there was found to be no difference in patient efficacy or outcome. NIH throws a lot of money at this. They found, because of the opioid epidemic and the widespread global initiatives to reduce opioid dependency for pain management, of course, lots of money is thrown, including a white paper that we'll just get to for that. Low back pain, bread and butter stuff. This is the white paper. I was privileged and honored to be a part of this NIH-funded initiative. It was a two-year project that we were tasked with through the pain task force of NIH, and I was the voice. I was lucky to be selected as the voice of yoga therapy in writing this. This is also motivating and compelling insurance for yoga therapy. And this is a great article that even after an individualized one session of yoga therapy to reduce physical and emotional symptoms in hospitalized hematological, this is blood cancer patients, was found to be efficacious and long-term lasting over time. That's a huge article. More stuff. This is very cool because it's put out, it was published by JAMA a handful of years ago. It is opioid-related pain, a systemic review. It was found in this meta-analysis that yoga and yoga therapy were important as part of a treatment plan. JAMA is the highest level of medical research in the world. The Journal of American Medical Association. It was a big deal. Here's more stuff on that. And let's look at safety. Yes, it is our responsibility to be informed, to understand the evidence for yoga, to appreciate its strengths and limitations in order to guide patients towards safe and appropriate practice. Ken, I believe this is, are you there? There you are. Ken, I think this, Judy Flatterbush was an alumni of your program, and this was written in one of her articles. Okay, you've been in child's pose for almost 3 weeks, just checking everything's okay. Safety, big deal right here. And more stuff on RTCs with self-limiting joint and back pain. If, as a yoga therapist, I want to help patients with cancer pain, I should know something about cancer and cancer pain. I should know something about this patient. What is this patient feeling right now? What is this patient feeling most of the time? What about pain? What about anxiety? What about the unique symptoms and challenges of this patient today? How and if yoga therapy can help this patient? Where can I refer if not? And what precautions do I need to know about that will apply to this patient? We have to know what to ask. We have to know ways to comply with and contribute to each patient's existing treatment plan for long and short and long terms of adaptation and healing. We need to know meaningful yoga therapy and allopathic treatment vocabularies so that professionals can easily and effectively communicate and treat. We have to be collaborative with our screening for patients, and we have to have continuing education platforms. This is what it looks like. We look at quality of movement, which is any movement in your body, your cells dividing, you're digesting something, your heart is beating, your endocrine system is firing. We're looking at quality of respiration, what it is and what is the pattern of your in-breath and your out-breath. How does that change? What can we access? How can we assess? How can we use the breath to improve what we're feeling right now, what we're thinking, and the quality of thought, which is simply what's happening right now as you're thinking. It's observable. What are the implications for clinical practice that in concord with physicians and psychologists? The yoga therapist offers a unique bridge between the two, between the way we move and the way we think, and encourages the patient to self-manage that state of balance or health. Based on the structure and discipline of yoga therapy principles, yoga therapists instruct patients in adaptive mindfulness that provide tools for self-administration, regular treatment techniques as needed on demand. This is what Ken calls Krogerable. When reading a note from a yoga therapist, your managing physician wants to know two things. Can you tell me if my patient is improving or not relative to my patient's chief complaint? It's a yes or no. That's all the physician wants to know. That's all the healthcare team wants to know. That's why you're on staff. These are some case studies. This is kind of what we did. This is the sequence for that. This is JK is not his real name. Number 1. This is the sequence for number 4. And this is our exit strategy. We're one of the few therapies within clinical settings that have an exit strategy that emphasizes to the patient why they don't need to come back anymore, because they've internalized and been able to self-apply techniques. You can read the italics. Those are actual quotes from this patient. My headache went away once there was some relaxation. I haven't had pain for quite a while now. I don't feel anything in my low back. The pain went to sleep. When you relax on your own without telling yourself to relax, it happens naturally. After I tried so many approaches to living with pain, I finally tried yoga therapy. Ken, this is what our conversation was before we started. After only 4 sessions, I felt I was learning how I could mentally and physically cope with things, including the memories. And that speaks, Stephanie, to what you were saying, including the memories of what caused my pain and the fears of what could trigger the pain. And I could do this by myself without adding more drugs. I believe I can keep going. How can you make this happen? This is it. Yoga therapy is part of a multidisciplinary healthcare team. IIYT, the Magnet School Initiative, you can make this happen. All right. The Magnet School Initiative is dedicating to fostering partnerships with 200-hour yoga teacher training programs, demonstrating excellence in teaching and professional preparation. IIYT offers graduates of an IIYT Level 1 Magnet School Priority access, as well as financial compensation to advanced learning and certification as a yoga therapist. What are the learning and financial benefits for students enrolled in your IIYT Level 1 Magnet School? In addition to your 200-hour curriculum, students receive free regular presentations on yoga therapy presented by IIYT faculties. These talks are designed to provide the student with an introduction to clinical applications, research, professional development, and yoga therapy. IIYT Magnet School schools provide students with free access to level 3 one-on-one clinics. Students in an IIYT Level 1 Magnet program receive free attendance to selected IIYT Level 2 lectures for credit. Participation allows for collegiate academic activities with IIYT Level 1 Magnet schools nationwide. Students successfully completing a Level 1 Magnet School 200-hour yoga teacher training program are eligible for priority consideration for entrance to the IIYT program's advanced study and certification in yoga therapy. They receive priority discounted tuition for the Level 2 program, 20% tuition discount, and priority discounted registration for students attending the annual IIYT Clinical Advancements in Yoga Therapy and Research for credit. And here it is. We just received the save the date. This is for our first annual Symposium on Clinical Advancements in Yoga Therapy and Research. It will be held January 17th through 19th in Southfield in Metro Detroit. Advancing yoga therapy as a first-line treatment in healthcare. We are extraordinarily honored as keynote speakers, among other, Dean Ornish, Ann Ornish, and Dr. Timothy McCall. This is a CME, which means that for anyone in any health-related field, they have CME, continuing medical education unit, as well as continuing education from IAYT and Yoga Alliance. You can make this happen. My question, is this yoga therapy? Does it still stick? Or is there a deeper part of the pond where you can throw a stone? Thank you. Thank you all for your attention and welcome any comments you might have, particularly directed, I think, to Sean or Stephanie or Ken or Kyla.
I have a question. Is this something that is covered by patients' insurance? I'm just wondering how like accessible it is for patients once they are like have interest in it. Because I work as a nurse, so even if I don't continue with this, I would love to like let them know this is an option to be able to be a resource for it for them.
Right. So IAYT is working very, very hard in establishing an insurance line item coding. As you know, everything covered by insurance has to have a code, and that code is a joint collaboration between the American Medical Association and the United States government. It is on the Senate floor. There are many, many hoops to jump through, but as of today, yoga therapy does not have a code.
Okay.
The way the patients have access to yoga therapy is through our clinical externship program, which is on-site rotation. We are in 4 hospitals, soon to be 5. Also, by employing a yoga therapist on staff, a patient receives yoga therapy vis-a-vis the yoga therapist. The yoga therapist receives a salary from the department. The patient isn't charged per se individually for treatment. The yoga therapist receives a salary for providing yoga therapy within that department.
Yeah. Okay. And then my next question, sorry. Is it common then once you are, I guess, assigned to an individual that you will continue to follow through with them once they're discharged from the hospital? So you're seeing them in an outpatient setting or as long as they want to continue with you? Or is it usually only in the hospital setting? Some people are only outpatient.
It's a good question. Thank you. For example, in the Center for Pain Medicine at Beaumont or Corwell, and at the at Henry Ford Hospital systems in the pain department, the periprocedural work that we do is outpatient, but the patient does return for post-op evaluation and ongoing treatment. At that point, the patient, what the pain departments are telling us, will make an appointment only when the yoga therapists are there. All right. We also have ongoing through IAYT, ongoing free virtual one-on-one yoga clinic sessions this is extremely important, for example, for the non-ambulatory. They're one-on-one, and I bow to Ken and Sean, who are both, her currently involved and alumni in those ongoing treatments, and as to the extent that we are able to, yes, there is a fluency with a patient and an extern if we can match that up. If not, it's still one-on-one. It's still through the program. It's mentored, supervised, and there are many patients who like to experience different externs and receive different ideas on the same thing. Ken and Sean, do you have anything to add to that in terms of your experience?
I would add one that emphasizes the importance of the good clinical notes, because if you're following up other people, and you usually would have collaborative meetings prior to another session. So if you were getting somebody else, you would get the notes and you'd get a little discussion about it. To me, those were some of the most rewarding things ever. Both the one-on-ones that we did virtually, and I got to do a little bit of those clinically before COVID shut us down. And being in the pain clinics, being actually in the rooms, and you're a nurse, so it wouldn't be quite a different setting for you. But you know, you're in these x-ray rooms where people are getting injections or nerve burns or whatever is going on, and you're dressed up and you're working with these people that are in very highly stressed situations, and they will tell you after they've done this, and you may not feel that you've made that much of an impact on them, but they will tell you straight up how much of an impact that it has, and knowing that these techniques that you've learned and you may not be so confident in them at that point really make a difference in somebody's life and really help in this pain management and stress reduction. It's just phenomenal.
Yeah, absolutely. Thank you. I'll ask another question. Is it, I guess I'm just curious to know how the assessment is set up for an individual. So is there like per like diagnoses, you have a full almost like a basket of different like flows or different things that you can give them options to choose from? Or is it more, I mean, I'm sure it's more individualized, but are you practicing certain movements specific to certain diagnoses?
Thanks. It's another great question. I very much appreciate it. We have two initial intakes. One is a patient-provided intake history, which is for the one-on-one encounters only, not for the group sessions. And then we have an on-site, whether virtual or physical, yoga therapist provided intake history that is generated each and every encounter. Based on that information and any previous notes that we have, and anything that the patient provides us with, we form a treatment plan specifically curated for that individual. And that's what Ken was referring to with the patient prep sessions prior to each of those Sunday clinics, where we select patients and we develop the treatment plan as a group together with the cohort. As you know, what often happens is that the chief complaint changes by the time the patient actually appears. And it is the life of a clinician. It is the life of the clinician. And this is why this all happens during the clinical externship, is to be able to maintain agility, responsibility, and rigor. So that we adhere to the standards, and we adhere most of all to the patient-centered care. So if the chief complaint has been adjusted for whatever reason, and I see Sean smile, she's been through it already, even these early days. That is the training, that is the experience, as you know.
Thank you.
And that goes in the note. And that moves forward with the patient. Great questions.
Sean, the look on your face as soon as this
Yeah.
question
Sean
started
is
was
like,
priceless.
oh, man. If anyone here would like to experience as coming in experience the one-on-one free virtual yoga therapy sessions, please let me know, or please let Ken know, Sean, Stephanie. It is the sooner the better. We do get, we do have a lot of people who would like to sign up. So let us know. The form will be sent to you. Just click on as many dates as you like.
So I will thank you all for showing up, and thank you, Veronica, for
You.
everything.
It's wonderful to be
Yeah.
here. Thank you, Ken, for organizing this, for bringing us together. Thank you all for your interest, for sure. Supported and encouraged.